Vitamin D, a crucial nutrient for the body, plays a vital role in many physiological processes. Its primary function includes aiding in the absorption of calcium, promoting bone health, and supporting immune function. However, recent studies have begun to suggest that low vitamin D levels may not only be a consequence of poor health, but could actually be linked to weight gain, particularly in those who are overweight or obese. While the connection between vitamin D deficiency and weight gain has been increasingly studied, the exact relationship remains complex and far from fully understood, with some experts pointing to weight gain as a potential risk factor for vitamin D deficiency, rather than the other way around. Current research indicates that there might be a connection between low vitamin D levels and an increased likelihood of obesity. However, whether a vitamin D deficiency directly contributes to weight gain, or if it is simply an incidental finding in individuals with excess weight, is still uncertain. According to Professor Caroline Stokes, head of the Food and Health Group at Humboldt University in Berlin, while there is a noticeable link between low vitamin D levels and obesity, vitamin D deficiency itself is likely not the cause of weight gain. In fact, obesity may increase the risk of developing a vitamin D deficiency due to the way fat tissue interacts with vitamin D. Fat cells can sequester vitamin D, making it less available for the body's normal processes. Consequently, people with higher body weight require more vitamin D, and the time it takes to correct a deficiency is longer. This connection suggests that those with obesity might have a compounded problem. Not only do they struggle with excess weight, but they may also experience vitamin D deficiency, which could further impact their overall health. Despite these findings, the scientific community remains divided on the direct role vitamin D plays in weight management. Professor Caroline Apovian, a leading expert at Harvard Medical School, acknowledges that while a vitamin D deficiency might not be the direct cause of weight gain, it could still play an indirect role. She suggests that vitamin D has anti-inflammatory properties that affect fat cells. A deficiency in vitamin D may lead to increased inflammation in fat tissue, potentially exacerbating metabolic issues that are associated with obesity. This mechanism could create a vicious cycle where inflammation promotes further weight gain and obesity, which in turn worsens vitamin D deficiency, leaving individuals trapped in a detrimental loop. Additionally, vitamin D plays an essential role in calcium absorption in the gut. A deficiency in vitamin D can impair calcium absorption, which in turn may affect bone density over time. Interestingly, research shows that overweight individuals often have higher bone density than their slimmer counterparts. This could be because the fat tissue stores enough vitamin D to maintain bone health, but it also means that the fat stores are not as readily available to support other physiological functions, contributing to the cycle of deficiency. Another contributing factor could be reduced exposure to sunlight, a primary source of vitamin D. Many individuals with obesity may have mobility restrictions, leading to less time spent outdoors and, consequently, lower vitamin D synthesis. This reduced exposure to sunlight could be one of the reasons why people with obesity often have lower vitamin D levels. While vitamin D supplementation has shown promise in some studies, the results have been inconsistent, with some people experiencing little to no improvement in their vitamin D levels, despite supplementation. The link between obesity and vitamin D deficiency is complex and multifaceted. The specific mechanisms through which vitamin D influences weight gain are not yet fully understood, and more research is needed to clarify these connections. While some studies suggest that vitamin D could have a positive impact on weight management by reducing inflammation in fat cells or promoting healthy metabolic processes, these findings are far from conclusive. Furthermore, even if vitamin D deficiency is linked to weight gain, it is unlikely that addressing this deficiency alone would be sufficient to reverse obesity or prevent weight gain in individuals. There are far more significant and complex factors at play, including genetics, diet, physical activity, and environmental influences, which all contribute to weight management. Therefore, while it is essential to address vitamin D deficiencies, doing so in isolation is unlikely to provide a comprehensive solution to the obesity epidemic. The implications of these findings are not to be taken lightly. While vitamin D is an essential nutrient that supports many bodily functions, its potential role in weight management should not overshadow the broader and more pressing issues related to obesity. Overweight individuals should not rely solely on vitamin D supplements as a means of managing their weight, as this could lead to misplaced expectations and missed opportunities for addressing other crucial aspects of their health. In conclusion, While there is a clear association between vitamin D deficiency and obesity, the precise nature of this relationship remains uncertain. There is evidence to suggest that a deficiency in vitamin D could contribute to metabolic complications that exacerbate weight gain, but it is equally plausible that excess weight could increase the risk of vitamin D deficiency. Until more definitive research is conducted, individuals should be cautious about assuming that correcting a vitamin D deficiency will resolve weight issues. Rather, a more holistic approach to weight management, focusing on diet, exercise, and overall lifestyle changes, remains the most effective strategy for addressing obesity and its related health consequences.